Can you please send, sir?
Okay. So first, just look at the on the screen, and after the class, I will send you, because time is running, and I hope you know that there is a limited period of time while going through the Zoom. So after class, I will send you.
Okay.
Okay, so before going to that section, just because it's going to be very quickly for this starting 10 minutes is going to be very important for you. Like there's 9 subjects, as I think everyone knows, and here in the file there is overall keywords, right? So the keywords are in the order. Okay, like it's going to be started from med biology, biochemistry, physiology, path, anat, and physio. The next one will be pharma and micro, pharma micro, and one is histo. And in the last section, there is a stain or process. Okay. So here you should know that what is the most important subject while going through the preparation, this part. Okay. And which is the easy, it is this one. This part is easy one, and this one is important. So let's begin with the keywords. Is it visible to everyone?
Yes.
Okay. So friends, what is most important that in previous section I have teach all these things, but here I'm going to cover how you are going to use it. Okay, so what are those tricks which I personally recommend that while going through the questions, because anatomy part is supposed to be toughest while dealing with the question, but there are few things which if you keep in mind, that there is very beautiful diagram. Okay, you can see here it is visible. Let's go. I will send later here. So here, like first, just keep in mind that anatomy section is supposed to be not that much important because it contributes to around 11%, right? So here, like in the keywords, it is given like bursa umentalis, okay, and bursa pregastrica. What happened that first what you have to important keep in mind that these kind of things while solving, if you think that you just study it one by one and it is going to give you a result, so just forget that, because it is not going to give the result by just remembering all these things. How you can use them in the questions, what will be there, that only these words will be reflecting how you should remember. Okay, it was very in the class I gave one notes. Okay, so as first what you have to keep in mind that there are the few words. Okay, this part, let me show you one figure, because how I use it while preparing, like just you imagine one man. Okay, backside, if it is bursa omentalis, so you have to remember the starting the mnemonics. There is another section, so it is like we say everyone, like it is back part. Okay, so here it is back part, so B for here bum we say back part, that is it is bursa omentalis. But in the stomach section, okay, it is not to oftenly asked question, so here you don't have to be that much strict with this kind of questions, especially this part. Okay, let me tell you initially what happened, that what are the important structures of the body. If you see, okay, in the question section it is given like nerve part. Okay, so here what happened, you don't have to go one by one every part, you can see first. So in the all over the questions, it is not important that you read everything in the anatomy, because anatomy itself is a very vast syllabus. Okay, so here is that diagram. Let me show you that diagram, because I think it is going to better understand, because everything is important in this. Yeah, can you see this diagram? Hello, hello guys.
Yes, yes,
Yes,
yes.
yes. Okay, so because that part after this you will be able to understand. In anatomy section, what is very important for you to understand, because as you can see here, not every part in the body have been identified, have been marked, right? So if you think that you will start from the anatomy like blood vascular system or embryogenesis, and it is going to give you the best answer, so it will not be the correct one. But here I have given only the highlighted portions, right? You can see it after the class, you will receive it in your chat, or also it will be available for the exam, for exam point of view. Like everything, if you go through the Kaplan or if you go through the other literature, it is going to be important. But here I have given a compact thing. Can you see it? Is it visible?
Yes, yes.
Okay. So what is going to happen? That how we supposed to study? Like anatomy, how you have to cover that? Just take, either you can take printout of this chart, okay, and you have to keep with you, or you can just go through these things, because what happened in Ukrainian literature, they have given it in the Russian format, and also they follow the Latin format, right? So here it is divided on in the system according to the analytical point of view. In anatomy, what happened, that you can divide it in the like head section, upper limb, lower limb, and pelvic zone. Okay, in the keyword, what you are going to see, that there will be only and only given like names are given, right? So what you have to do, that just you have to remember those part which are very oftenly asked. Okay, so what happened, that how you should remember, like when you see this chart, so only this part is going to conclude the overall result. And later while going through this kind of explanation, The next one is important topic, what you should keep in mind. Or you can see here, I'm giving you very short description of these things. So it will be available for you also. But let me name them, because I think that when we start from the anatomy, what we think that it is a very important subject, when especially when we are in the first year. But it is not that much important, because it contain only 11%. But if you have the initial Latin language information, so it is going to help you. Simple mnemonics or trick which you can use while going through the very important things topic wise, right? So what happened here? First, let us start from the one by one. This I think you have seen. Now we will look at the, yeah. Now as you have seen that there is a lots of things, but you don't have to remember everything from the anatomy. You have to start from the, like, it is complete body, it is neck part, it is thoracic part, upper limb, and lower limb. Okay, so in head part of anatomy, according to, especially on the Krok-1, how you are going to differentiate them? The first part will be head, second part is going to be neck, third part is going to be upper limb. It is going to be further divided into three format, like fore, mid, and previous hind. Thoracic part, you have to divide into two segment. One will be the upper and another will be the lower. Okay, so pelvic zone is going to be differentiated in two format, because in Krok they especially ask, I think guys, I think you understand that you don't have that much time, or also you are not interested to go through the encyclopedia. So I'm covering only those topics which is very important from Krok point of view, and they are really helpful. In pelvic studies, when you are going to study, it should be in two format, male and female. Lower limb is most neglected part of human body in Krok. That's why you don't have to go with the lower limb again and again. And there is only and only what they ask, blood vessels or nerve. This is your anatomy structure while going through the study. But I think now it is easy for you, because if you follow the BT Chaurasia, or you go through the any other literature, it may be Snails, Kaplan, so they have a lots of things. Okay, so let's begin with the very important thing, very most famous and most confusing thing, that is the hand part. Okay, because I hope you understand that there's not that much time that we will cover everything in one video. How you should remember that, I think this you have seen. Just believe me that these are the only important points which you have to keep in mind. Now we will go for the hand. When you start studying about hand, in that moment, what you have to remember? Let me write down there. When you go for the hand, you have to start this section like this. Any one of you guys, please tell me that what is this? What is the name of this zone? This zone.
Axillary.
Yes, you're right. So that one is axillary zone. And what we say when we talk about something which is nearby body, like medial line, this part.
Central part.
Okay, central or medial. Actually, these things are important to understand to decode the real questions. And do you know the difference between like prone and supine? I think everyone knows. Do you know or should I tell? Okay. When your hands are like this way and in you, it's like you can see this part. That is your prone position. And backward is supine. Or in the question, actually, why I'm telling you, because these are the things which just force you to just escape the questions. Okay, so my here main concern to let you familiar with all these things. Only then you will be able to crack the keywords, because in the keywords or anywhere whenever you are going to learn the concepts, these you should know. Okay, one thing now I'm giving you trick how to deal with the questions. Okay, we are starting from the head section. In the head section, just remember very important thing. Sorry, we are talking about hand here only. In hand, those who know, this part is deltoid muscle, and here it is biceps. And the back side, boys who go, those who go gym, they know there is triceps. You can see by from back side. So in Krok, how you have to deal with the questions? Whenever in the question, okay, just remember this thing that whenever in the question you see, I mean, in the question, if you see it is asking or saying that biceps muscles or biceps, there is every time they have, because it is visible. Sorry, red color. So the visible part will be always and always upper one, and upper one. Anyone can guess? Which kind of nerve will be there, which available over the surface?
Brachial nerve.
No, brachial nerves are found inner side. This is the layer. If I ask you, this is first layer, it is outer environment, it is inner. So the innermost, what we have the basic main blood vessels, and outer we have superficial or subcutaneous or proprio. So whenever in the question it is asking about appearance or upper side, then you have to go for the biceps. There will be musculocutaneous. Okay. To not make it that much complicated, I will give you detail in the next section, because it is a Krok keywords and I am just considering most of you know the concept, because few of my students requested to rapid review. That's why I'm giving you the difference, only and only difference, that how you can go through the how you can go through the answers. Okay, now just remember 4-line concept, because I think it's going to be too long if I explain everything. Yeah, these number you have to keep in mind. 24 muscle point of view, flexor digitorum superficial. 13 okay, 13, that is medial. One finger when we ask, that is longus. 25. I think everyone have seen the Superman neck movie. How here I give you simple mnemonics here. I'm going to explain. Whenever there is 24 number, just keep one trick in mind. 24, it is 25-year-old, in that moment, we talk about that if you have watched the movie Superman, that his age was there 24. So remember for that or leave that thing. What is the age of adult? It is 18 plus. Okay, 18 plus. That moment it is going to be always. And how you can remember that? There will be word super 24. When we talk about 13-year-old, in that actually these are the only tricks to differentiate these especially kind of question, because most of the time there is a lots of queries which came from this particular topic. Okay, so here what you have to see, that what is the age which is less than 24. Actually pediatric age is more than 11 or 12. So it is neither pediatric, neither child, nor the adult. That's why it is middle. So here it is going to be the median. Why we talk about longest? Because it is a single one. Okay, palmar, how you can remember? When we talk about palm have 5 fingers. So in the question, there will be the 5. Second and fifth finger. This trick, trust me, only this trick is going to solve each and every kind of question which will be asked from the muscle or nerve supply to the forehand. This is the easiest trick. Actually, in the keyword, you will see them, but you will never understand to use them, utilize them. That's what I'm telling you. Whenever in the question there is second and fourth finger, just write down with the pencil or pen. 24. Just in the answer, see the super. You will get the answer. When you see the 13, just remember that what is the upper age, or it is going to be the like not pediatric, or there is middle one. That's why it is a medial now. Because what happened that most of the times you get confused, it is little finger asking or middle finger asking, or there is second or third. Just leave everything. Remember this trick only. Your every question is going to be solved. Okay, now I told you one key concept of the hand. Another one is about head. In the head section, what happened that when, because most of the guys ask me, you guys understood, or should I explain it again?
It's clear, sir.
Okay, because it is not a medical concept, it is a trick to solve question. Okay, because if you go one by one concept, so you will get disturbed. I will explain them in anatomy session, and that will be another thing. But just trust me, according to Krok question, these are the best to solve. Now we talk about the next one is head. How you should solve the head kind of questions. Whenever in the question there is a head is given, just consider head part, divide it like this. Okay, those who know the basic anatomy, you guys, if you know, there's trigeminal nerve. Okay, trigeminal nerve, it has 3 branch. Just keep it here near ear, and it has 3 branch. This part is the mandibular part. This part is mandibular part. This part is maxillary part, and this part is upper. Okay, so what you have to keep in mind every time in question, okay, every time whenever there are symptoms, that symptoms are spread, don't just remember those words. Just it will be very easy, like supply skin sensitivity loss, inflammation, or some kinds of, there will be any kind of right half face is disturbed. Okay, or there is tongue will be also loss of pain, thermal sensitivity. There is a lots of variety. Okay, if I start you explaining each and every symptom, so trust me, it is going to be another way. Leave everything. Whenever you see the question based on face section, divide them in 3 parts and try to localized. If question is localizing only one this zone, how you will differentiate? Whenever we talk about eye, how eye look like this. Okay. So in question, if it is asked, take it central part, lower eyelid, lower eyelid. There is swelling, reddening of nose. So every time it is going to be maxillary branch. Answer is going to be there, maxillary branch. Okay, maxillary branch of trigeminal nerve. In face only, because this is the highest level which by which you can differentiate. But those who don't know any section, what kind of nerves are there, you have to keep in mind only 2 will be the answer, either trigeminal, either facial. Don't go for any other answer whenever you see the question which is came from the head department and there's loss of sensitivity, loss of pain and all. Only and only trigeminal and facial. More differentiate which when you have to do, just anatomically locate them where the exactly that pain is, sorry, that symptoms are located. This is the second most important thing in anatomy whenever you solve the question. So next one is your lower leg portion. I think everyone knows that whenever there is congenital heart disease, or it is supposed to be any kinds of heart failure. So we have, okay. So in the Krok, what especially is going to happen? In the leg section, very important topic, like this is, sorry, this one is your leg, like leg zone, knee, okay. I'm just keeping on most confused part, because easy one you can get it easily, or you can watch anyone's video, or anyone can make understand. These are the things which are really very confusing. So just focus on three concepts. Trust me, they are going to help you solve 30 or 40 type of questions from the anatomy only. So here, what is that? Everyone knows that this part is patella, this part is femur, this part is here. See the question, if it is going to be repeated. So the answer is going to be from femur only. So because femur part is not that much important. Important part is actually confusing part is lower limb. They will never ask you from this section. So you have to remember only these basic differences. What are those basic differences? First, cruciferous ligament they will ask. You have to keep in mind, if there is anterior and posterior displacement of tibia, that moment cruciferous ligament, it just remember like cruise. There will be other things also. You have to remember only this thing. No bone will be affected because it is a floating cartilage. And also the next, what they will ask, there is, if you remember, when your leg is kept like this part, calf muscles. So what you have to keep in mind, there is cruciferous from patellar zone, or it is going to be the next question which they will ask, it may be present, that is vein about Safina Magnum. So how you have to remember that it is cuff, it is soft. So name is going to be Safina. Trick to remember. Okay. In the question, it will be given in broad way. Dilated blood vessels, anterior medial surface of the lower leg. So what does it mean? Anterior medial. When that person is standing here and it is anterior part, anterior medial means it is talking about this part. So anterior medial surface. So here what you have to remember, when they will say there is a sock or calf muscle or lower leg, every time when you see this word, Remember, Safina is going to be answer. The next one, there is two part. Remember in the starting, I told you that either it is going to be medial part or it is going to be a lateral part. What does it mean, medial part? When anything in the body which lie this plane, central plane, that is medial, peripheral, that is lateral. In medial part, you have this is going you need to remember, and in the lateral part, same explanation is going to be longus peroneal. Okay, why I'm telling you, because there is a lots of things in the nerve or neural anatomy, but these are the only strictly Krok based, and these are the confusing. When you go through the conceptually, then definitely you will be confused. So in the last tip, in the last moment of your preparation, don't confuse yourself. Just remember two things. When it is medial part, it is going to be Safina Magna. When it is lateral part, so it is going to be the long peroneal. Okay. Now, third thing, as you know that it is a tibia and fibula. Whenever in the question you found the fibula mentioned, then fibularis will be the answer. Otherwise, actually it is one time asked question. Every time, most of the time, you will be just you will be confused between these three terms: one, two, and another which will be confused: cruciferous and Sophia and peroneal. These are the most confusing part while going through the questions. Others are not going to. They will just make a environment like it is a diabetic patient or someone is having other kind of infection, elevation of food. These are the additional things. Just remember, when symptoms are from the lateral side, answer is going to be the peroneal. When it is a medial side, go for the Safina Magnum. That's it. Okay. Now, the third thing in anatomy, what you have to keep in mind, I think everyone knows the anatomical position of the abdomen. If you don't know, so here I'm quickly telling you trick how you should remember. In the surgery, when it will start with you or you will start studying surgery, so that moment you will learn the incision point. But not if you are not able to, right now you're not studying the surgery, so easy way to remember, just divide this part, and let it be umbilical. It is your leg, your hand, neck, head. So how you have to remember, in the internet you will see every time they will divide it in the four part. Okay, but when it is question time, you get easily confused. Okay, so what I mean to tell you, when you are especially going for the Krok preparation, that moment just forget this. Only and only thing, remember this thing known as umbilicus, that is McBurney point, this part only. Remaining everything are simply just useless because they are not going to give a result. So in this moment, it is important for you to just remember McBurney point, or they will say appendicitis, appendix and all. This only keep in mind. Now the next one, upper hypochondrium, right hypochondrium, epigastrium. What are those things? Okay. Anything. Even there is one more question, that is hypospadia and epispadia. Okay, so it is from the penis and urethral section. So that is another thing. But every time, whenever it is term AP, means upper, it will be given in question. That moment, just keep in mind our normal anatomical position, and here remember this part like this. Start from this. I know it is looking a little bit complicated. Let me make it simple. Start line from here, go to the stomach, fill it, and just make an arrow, and it is crossing. It is not same thing. So in this movement, what you have to keep in mind that those who know, I think for you it's better, but those who don't know, for you, I'm telling you, this part having the rib cage, and there is cardiac hiatus, and actually it is more situated here. So you have to remember this one is ascending part, this is transverse like T, and this one is descending. So in this anatomy part, what is most important, most confusing? Which time, in which question this is going to be the answer? In which question it is going to be the answer? Diverticulum. Because every time you will see symptoms are same. So that moment, what we have to keep in mind that here, when it is Magbury point, or keywords, what you have to keep in mind, Magbury point, or it will be right gastric pain, or right lower gastric pain. That moment only go for these answers. Actually, it is a most expected question according to the recent analytical report of question paper. And whenever it talk about descending, sorry, it is ascending here. When descending part of colon, so you have to remember D diverticulum, D descending. In appendix, simply appendix, everyone knows it's the most common disease. So whenever in the question you see the descending colon involved, go for the diverticulum. This will be the 100% answer. You don't have to confuse yourself with these things. And I think these are the very important very important things, because my friends are here who are going to write the Krok examination on 13th of May. That's why I gave you very short trick how to differentiate these kind of questions. And to initial, actually, those who have fresh examination, don't worry. For you, I will give the explanation, and then I will go for the trick. These are the final conclusion trick, how you can differentiate in the questions, because I know most of you, like those who are the new, you don't know that what are the difference between them, and why these names are like, how to differentiate between them, this part. So it will be in proper session, but these are the tricky question. It's really asked, and most of the time you do the wrong answer. Any explanation you want me to repeat for any particular topic? Sarah, I think you're here.
No.
Any particular topic, so I can explain here, or trick I can give you?
Can continue, sir.
Okay, so the next one, which this thing from the anatomy department, which is supposed to be asked with you, or if you which this time added, it was from the actually one most tricky thing which asked in the question, that is from sternocleidomastoid muscle or jugular vein. Every time when it is in the question, so most of the time you do the wrong. Just remember, imagine things whenever in the question, because in the video I told you that when you are able to explain what question is really asking, only then you will be able to solve. Otherwise, if you don't know the language of the question, then how can you solve? What is the correct answer? So in this moment, I'm telling you here the easy way, simplest way how you can define that this part is from the sternocleidomastoid or from the jugular vein. whenever in the question it is asked, okay, there is involvement of excretory muscle or expiration, breathing problem, all these things, that movement don't touch any other option. Every time your answer is going to be from sternocleidomastoid, this part. This is going to be your answer. And when, and one thing more, in especially neck zone, when you solve the question and it is asking about this part only, because anatomy, I personally recommend that you should study zone wise. Go through the, as I told you, lower limb problem. Actually, 90% of questions from that particular segment which I told you, from the, even from the upper limb and also from the thoracic zone also. Okay, so here in next section, 90% of questions are going to be asked from only and only this section, this zone. Whenever in the question it says lateral part in head, go for the sternocleidomastoid. Close your eyes, it is going to be answer. Lateral sterno. Or whenever in the question it says medial part, medial part, so in this moment your jugularis vein, anterior vein, anterior jugular vein, this will be the answer. Okay, these are the basic things which I explained you. And in the, and also there are lots of things, these are the conceptual, but these are the tricky and the 100% effective according to my personal observation. So by this you can go, you can solve this. And in the jugular vein, whenever there is this, I told you how you can, how can answer. When the lateral part is given, sternum will be the answer every time. But sometimes what will happen, that lateral wall of sternocleidomastoid muscle, it says like this. Okay, I will show you a picture the next time, because here remember that sternocleidomastoid muscle, I think everyone can see it easily, those who don't have fat the neck. So that moment what happened, you know, JVP, it is jugular vein pressure. Remember from this, because BP everyone knows, radial artery and brachial artery, whatever we palpate. Here, lateral wall of sternocleidomastoid, there is a bifurcation of jugular vein. It is not jugular vein only. It is it is the thick one. When it bifurcate, then outer one we palpate, JVP. And every time those things which you can palpate or pulse you can observe, they have the external origin. So it is external jugular vein. Are you getting my point, or should I repeat it?
No, sir, we are getting.
Okay. So every time, even in the brachial plexus, or if you are going from the radial artery, they have the external origin. You can't palpate the internal origin things. Okay. So when there in the question you are seeing that there is a lateral wall of sternocleidomastoid muscle, that moment it is going to be the answer from the external part, lateral wall of sternocleidomastoid muscle. In the question, you will also see that there is a dark blood coming out from the blood vessels. What you have to keep in mind, that in the question, when you ask about JVBP or there is a pulsation, that moment it is external part, right? But whenever in the question, even in the trauma section, if you see dark red or it is thick like this kind of things, so most of the time or almost aorta is going to be artery is going to be damaged or internal damage. Or in the question, whenever you see, I can give it explanation to you that why this is correct. But these are the things which you have to keep in mind, because concept are another thing. But while you are dealing with the questions, that moment what happened, you are unable to go through the concept. You need to answer within a second. Okay. So in the question, whenever you see dark red, thick, this kind of in the neck zone, that moment you most of the time you will get confused. Either it is internal or external. Then you play with the choice like 50-50%. No, whenever there is dark color, how you can remember it. Just remember, inside a room it is always dark when there is no light, electricity, obviously. So it is going to be dark. When it is outside, suppose it is daytime, so it is going to be light. So inside mean inner vessel or meal. But when you talk about outside, there is sky blue or light. Sky blue, why I said blue? Because if in the question you see the light color or any pathological form, they are not talking about dark, dense red color. So it is going to be the venous damage. These are the only important things which you have to keep in mind. They are the concept. It is not that much conceptual. Actually, they are practical things. While going through the questions, they are really helpful for you to solve. And most of the time, what I personally guess that which is going to be asked in the next question, next exam. Sorry, next means Krok exam. They are asking again and again from occipital zone. So every time that what happened, that most of the time they were asking question from the medial zone, and later they confuse the students by the asking the ulnar zone. But now suppose that this is the head part, it is nose and eye. This is ear. Question have been asked from the posterior part, and I think everyone knows occipital damage. Now next, because in Krok-2 questions which I'm doing that moment I have seen their important and favorite topic from the temporal zone. Okay, so don't forget about Wernicke area. Wernicke area, or there will be like a speech problem or writing from that moment, because what you will see, what you will understand, I can guess it. Those who are smart and you know the medical concepts, for you it is very good. But those who don't know what mistake you are going to do, I'm just telling you, you will think that it is a cortex and it is situated in the frontal lobe. So you will say frontal lobe is the answer. No, temporal is going to be the answer. So don't do this kind of things while going through the real examination, because as per the recent previous exam, they are changing the pattern. Okay, so you can't go by mugging up all these things, because they are really helpful. Okay, so I think any other topic from the which makes you confused, I can just clear it out. Okay, so those who are the new students, because it was actually basically oriented for the rapid revision classes. So I told you the most important facts, and I consider you all that you know the basic thing.
Hello. Hello.
Hello.
Path physiologist.
Path physiology topic. What topic?
Like a topic like bleeding, bleeding and some inflammation, like some is some soft portion like fibrinous, cavernous, like fibrinous होता है ना, fibrinous, cavernous, then the
Path,
inflammation mode.
path morphology, path physiology.
Sorry, path morphology.
path morphology हुआ ना?
path morpho.
Okay, okay, ठीक है. Well, actually, it's very important for the patho section. Actually, those who know that it is anatomy, path morpho, and path physio. Here we study about the appearance, and here we study about the function. Basic thing which is going to help every time when you are dealing with the question. Just remember what I'm telling, especially Nadeem. In the question, if you see the black color appearance, close your eyes and go for the answer every time necrosis. Every time. It may be possible that question will be too long, one paragraph for containing. Okay, so this is the shortest trick, which I personally recommend, that every time a long descriptive question is going to be asked in this way. Now I'm telling the another thing. Okay, here I think Tay-Sachs disease, cherry spot, and everyone knows that. Yeah, most important. How to differentiate between acute and chronic? Whenever in the question there is, first, I think everyone knows that acute glomerular nephritis, that moment meat slop urine. It is a very it is very like famous for acute glomerular nephritis, kidney disease. But when we go for the chronic, that moment, every time we get confused that how we should go. In chronic, remember these words, it will be available. Fibrinoid, spleen or kidney or liver size will be increased. Okay. Another thing, it may be, they may say they will be crescent, this kind of thing, yellow. All these things will be in the chronic section. But whenever it is acute is simplest to differentiate, because in acute section they may be like acute infection, acute viral infection. So how I personally recommend you in acute, if you remember that in acute infection, just remember this is also important from microbiology point of view. Acute infection, IgM responsible. This is important thing from microbiology. Okay, so here how you can remember, here M comes, so meat slop urine. Otherwise every time these are the, now in chronic section there is a lots of other things like chronic myelogenous leukemia, chronic osteomyelitis, and also they have the chronic sepsis, and they also have a few terms like chronic heart failure, chronic renal failure. They have the different term. Okay, if you want, then I can give you only keywords here because they have the special concepts to differentiate. Actually, it is, I think, useful. Okay, I'm just moving here. When in the question it is asked like chronic myelogenous leukemia. This is also covered in the previous topic, that chronic myelogenous leukemia. Here keywords which is that famous like spleen large and liver enlarge. But what I recommend, that how you should remember, that chronic myelogenous leukemia. Every time in the question, whenever you see leukemia condition or myelogenous condition, chronic means long time, simply. So whenever there is myelogenous leukemia, remember spleen will be affected every time. How you will get confused? You will think liver is there. Answer: liver may be there, hepatomegaly. Actually, liver is the second option. The first priority is spleen. Or in vice versa section, in the question it will be given that a patient is having enlarged spleen, hepatomegaly, spleen, hepatosplenoid marrow, bone marrow. All these things will be included. So in that moment, just remember, okay, every time when there is spleen enlarged, so leukemia is the most priority answer. Why? Because I think everyone know from the 12th class, this is a graveyard of RBCs. So they have their particular section that spleen. They lots of dead bodies are there. That's you can just imagine. They're confused. Now the next one, chronic osteomyelitis. Mellitus, don't get confused that it is mellitus and myelogenous are same. Myelogenous and mellitus are different. When it is like mellitus, it is inflammation. It is presence. So there is chronic osteomyelitis. In that moment, don't go for the spleen because there is inflammation. It is not present. So that moment question, and they will include the bone. Okay, bone of mandible. They will be there also in the option. So in mellitus case, there will be, just remember the first one. What is the before mellitus? Okay, every time myelo doesn't mean you should go for the spleen or liver. When there is leukemia, that is a standard thing to remember. When there is destruction of blood cells, then go for the spleen. The third one, which is very important, chroniocepsis or chronic sepsis, or there is a simply asepsis or sepsis. How to differentiate them? Okay, so in this question, what will happen that you have chroniocepsis or sepsis or chronic sepsis. Why there is a difference between tiger's heart, fatty parenchyma degeneration? These things are confusing. So here, just remember, whenever in question you see the chronic word, chronic, that moment you have to go for the stress-induced problems, pathological problems. Okay, and I hope that you remember that in this case you have further there is cellular cell injury. They have hypertrophy, atrophy, dystrophy. In my, I have given one chart, full chart there, that how to differentiate between them, but just I'm giving the quickly here. Hyperplasia. So how you have to remember that whenever in the question anything from this which is given, it is prolonged damage or prolonged stress. So in this case, how you have to remember, in the question it will be brown atrophy of liver, myocardium, spleen, cross-striated problem, renal amyloidosis. These things will be given. If you don't know the concept, you can watch my previous video. There was the amyloidosis complete concept, and I told that in the kidney, these things are only stress induced. Whenever you see, like easy thing in pathology, how you can solve, In the pathology, easily if you have like first thing what you have to see, there is anything which will be remember like amyloidosis, or it will be congruent positive, apple green birefringence, or in the question it will be clearly mentioned amyloidosis, and that I'm explaining it for because of renal failure. So how to remember in pathology, pathomorphology, that moment it is going to be second thing. If it's congruent positive, close your eyes and take the answer amyloidosis. If it is already given, second thing, see, it is talking about antibody or blood. Antibody or blood. Antibody or blood. If blood is there, go for secondary every time. Answer. If antibody, go for the look of primary. If heart is given, go for the senile, aged. These are the trick. Simple trick. If congruent positive and apple green birefringence, amyloidosis answer. If both are given there, they try to make question more difficult. In that moment, go for the another thing. They are antibody, they are mentioned, or blood. If blood vessels, like there is spleen involved or vascular system, then answer is going to be easily present from the secondary. Or if it is saying heart involved, old age person and all these things, that woman senile is going to be the answer. Now, the second thing in patho section, that is stain. In stain, whenever you see Sudan, it is fat. H and E, most of the time, they will talk about nuclear damage. Okay. Anything else? Nadim? Got it?
Okay, got it.
Anything else? I think now Akash, Nadeem, Shahid, Shivsankar, and Mikhail, Goa. If you have
Hello?
any
How to solve like a blood related question, like if A or AB is like
okay. Antigen antibody reaction, actually it is basically. I think everyone knows that is the universal donor, universal acceptor, and all these things. And unfortunately, they're not going to ask this kind of questions. Okay, so to understand the RBC questions, you should know the basic thing: concave shape, biconcave shape, and there is why I make it, because there is surface antigen. Every time you will get confused because of only and only antigen antibody. Blood, especially blood kind of questions, what you have to keep in mind every time, that if in the question, okay, I make one chart. Let me tell you that chart. Okay. Okay, I'm explaining here concept, and I will send that chart. Actually, that chart is very useful. From by this you can solve every type of questions which is asked from that particular department.
Okay, okay.
Blood actually blood phenomena, they have every time antigen antibody reaction. Okay. How actually must be there. Okay, just remember. I mean, here I'm telling the concept, and I will send the letter that that chart. Actually, in chart you will find out it is given like this way, like O A B A B. Antigen are those things which present over the surface of the RBC molecules. Okay, so in question, whenever you see there is antigenic reaction with, okay, those name which is given there, they are the answer. Just copy same. If they say O and A, so A will be the answer. A and B, AB will be the answer. If say only B and O, B will be answer. Antigen reaction will be the first key to remember. Another thing, in another way, how they can represent, they do not show the reaction with antigen serum of love or anti-antigen. Antigenic reaction, that same answer. Anti-antigenic, here this is actually a little bit tricky. Okay, this is a straightforward simple answer. But now what they are doing, they will say it do not react with the anti-antigen of the O or anti-antigen of the A. If it say it do not react with the anti-antigen of A, so it may be B or it may be O. So it is two-step question. First way, first key clue is this one. Second key, whenever it says that anti-antigen, so from that anti-antigen, it do not react. Okay, like it do not react, it react with anti-antigen of the A. So opposite, the next one will be answer. Like if it react with the anti-antigen of A, so in that moment you don't have to go like it do not react with the anti-antigen of A. Simply it means that antigen of A is not present here. Antigen of A absent. Okay, but that doesn't mean that B present or O present. It only and only means that antigen of A is not present. So you will have to go for the next step. What will be the next step? Next step, they will say it also do not react with the anti-antigen of B. So means simply antigen of B is also not present. Okay. When antigen of A, antigen of B, both are not present, that moment you declare that changing point AB. Actually, it every time make confuse, because what you think antigen is antibody. It is not antibody. Antigen means they are the marker. In this case, what happened that antigen, like a question will be asked that which kind of blood group they have. So blood group determination is antigen antibody reaction. It is blood group determination. But antigen and antigen reaction with the serum, they are not having antigen antibody reaction. So in this case, just make it more simple. I think it will confuse you. So here, if it says that antigen of B, it do not react. So what you have to keep in mind, that simply next thing that they will say what will the blood group. Okay, what is the O blood group? How to remember easily, because this thing actually it is important and easy. Just remember, I think everyone knows O blood group containing like AB blood group having, it can take anyone's blood. So that's why it is universal acceptor. O positive can give to anyone. That is universal donor. Okay. Now AB and E concept everyone knows. So in this question, there is antigen of A absent, antigen of B is absent. Here what you can see that O positive donor and O positive can donate to everyone, but it cannot accept from everyone. This is the tricky thing. Only accept from O positive. And it can accept a universal acceptor. It can accept, it cannot give to anyone, but it can give blood to the A and B simultaneously, AB also. So what happened? Like if I talk about antidote, okay, just remove all these things. Remember that antidote, this is not having antidote. This is not having antibodies. This AB blood group, this is the weakest. That's why experimentally it is the weakest blood group. They get easily infected. They get easily blood related problems. But O positive, they have the rare problem. Why? They have the antigenic antibodies itself with them. So they are a strong blood group. So in question, every time if antigenic reaction with any kind of, so straightforward, that will be the answer. Or if it is anti-antigen, says, and that moment there is absent of antigen, means there will be no antigen antibody reaction. It is going to be AB. Okay. If there is antibody present, only then will be antigen antibody reaction. So this thing first, which will help you to solve the answer, and this one having the parts 2.1, 2.2. This is the way how you can solve. Got it?
Okay. Yes, got it.
Okay, I think. Anything else? Okay, so guys, I think you are also tired because I also have 5 classes today. So let's meet in the next. If you are ready, that you are able to solve the questions. So just practice more and more questions. Go for that. And remaining those who are having the fresh proc in the 2000, in June or in the 2022, for you there is a regular batch. So in regular batch, I'll meet you, because I think this is one of my good friend that Nadeem is also here, and he has Krok, right? So okay. Any question? Okay, fine. So guys, just take care and stay safe and study. Thank you. Thanks for giving your time.
Thank you.
Thank you, sir.